Okay, so let's devote a little bit more time on psychoanalysis, because I thought, my experience was that it was very useful. So psychoanalysis was invented, quote unquote, by Sigmund Freud, and has been expanded by numerous other thinkers. And at the heart of it, it's the TalkingCure. So originally it was called the TalkingCure. In fact, the mentor of Freud, Dr. Breuer, practiced a form of psychotherapy that was not called psychotherapy. It was called the TalkingCure. There's other origins, like before Freud, Mesmer was practicing hypnosis. And hypnosis was a kind of similar, that had some connections with psychoanalysis. But the idea is that we have an unconscious. So we've established this early on in the class. We have many of our filters are unconscious. Many of the dynamics that occur in how we perceive reality and make sense of it is automatic. And therefore, it's very hard to observe. So psychoanalysis is a method that is used to observe your unconscious processes. Now, different thinkers have different views of the unconscious, have different models of the unconscious. We've seen Sigmund Freud's view and Carl Jung's view. They have a slightly different diagram of the unconscious. But the method of how you explore the unconscious is remarkably similar across all psychoanalysts. Let me emphasize this. So psychoanalysis was started in the realm of abnormal psychology. So Freud, Carl Jung were working with people who were considered mentally ill. So their model was developed to help solve or cure patients who were mentally ill at a time when really there was not much medicine, didn't have much to do to help people with mental illnesses. So they had to develop a series, a model of the psyche and then an approach to treating patients. But I would say that even today, psychoanalysis is associated with people who have problems. But I'll wager that psychoanalysis is a great tool of self-exploration, whether you have mental problems or not. So a big obstacle that some people have in engaging in psychoanalysis is, well, I don't have a problem. I'm not depressed. I'm not psychotic. I'm normal. And I'd say, yeah, most likely, most of us are normal. But Freud would say there's no such thing as normality. There's an approximation. There's averages, ways of being, but practicing the psychoanalytical method can yield very useful rewards, even when you don't have a particular problem. So first of all, I would say we all have some problems, some issues. Let's call them issues, not problems. But also, we can expand our optimal functioning. We could become even better than we are. So mental health is not just curing problems, it's also becoming liberated, further liberated, becoming more conscious. So I just want to emphasize that. So you can benefit from psychoanalytical approaches. Not that I'm suggesting that everybody should do a psychoanalysis, but you can apply some of that stuff even if you don't have a particular issue that you think you want to work on. Indeed, by the way, psychoanalysis has been found to not be so effective in dealing with very serious mental issues like psychosis, psychotic patients. Psychoanalysis doesn't work. It works more for what Freud called neurosis, the class of illnesses that are called neurosis, depression being one of them. So depression, psychoanalysis can be a useful way of, a successful way of treating depression, but not psychosis. Patients who are psychotic are the type of patient who are more likely to be locked in to go to mental facilities. In fact, today, as we speak, there is no real cure. There's medication that are given to control symptoms, but there's no real cure for very, very serious mental illnesses. We haven't found that yet. So psychoanalysis is not it, but drugs are kind of like, help maintain symptoms. There can still be progress, though. There can be some degree of progress. This is all like science in the making. So the TalkingCure involves examining how your past shaped you. So when you start a psychoanalysis, typically you start by telling the psychoanalyst your life story. This is where I was born, this is what my parents were like, this is what it was like growing up, this is what happened. So you devote the first few sessions talking about your past. Then you discuss your present life. What is happening in my present reality? What am I experiencing? And a key aspect is you don't censor yourself. So you talk about stuff that's happening, even the stuff that you might be self-conscious about. Like I'm feeling, like this could be sexual issues. This could be, psychology, irrational fears. This could be feelings of inferiority. This could be feelings of anxiety. There are a lot of stuff that can happen that normally we don't like to think about or talk about because we feel like it makes us weak. So here the idea is like you talk about all of that. So it takes a certain degree of comfort with yourself and with the psychoanalyst to be able to put everything on the table. Right? To not be engaged in self-managing your image management. You try not to do that in psychoanalysis. You try to be authentic, honest. The idea that you don't have a personal relationship with your psychoanalyst outside of the therapeutic relationship is meant to help you be honest. What makes it hard to be fully honest and transparent with people in your life is that they have a stake in your life. You might be very connected to your significant other, but what if you start feeling that you're falling out of love? Or what if you're frustrated about things your partner does? Talking about that with your partner can be good. I think it's a healthy thing to do. But it can be helpful to have a third neutral party that you can talk to about that is not going to freak out about your issue or start judging you or start steering your thoughts, right? The other thing that you do is you try to observe manifestation of your unconscious. So there are a few manifestation of your unconscious. The key one that Freud and psychoanalysts did were dreams. So dreams are a portal, an avenue, a doorway to your unconscious. In fact, to Freud and Jung and all psychoanalysts, it's the real route to the unconscious. The best way to understand the unconscious for them is dreams, dream analysis, dream psychoanalysis. And that's kind of like a really odd, but I have found in my life, powerful way of understanding your psyche. And I know it's kind of out there. It seems like out there in a business class to talk about dream analysis. But in the context of understanding your filters and understanding other people, dreams are a tool that I have found personally to be very, very powerful. There's other manifestation of your unconscious. Freudian sleeps. How many of you have heard of Freudian sleeps? Yeah, what are Freudian sleeps? Do you remember?
Yeah, like when I think within your head you're thinking about something, which is often sex, and so maybe all of a sudden you say some sexual word instead of some other similar word when you're talking.
Yeah, Freud put a lot of emphasis on sexuality, so Freudian sleeps often were sexual in nature. And I would say that as time has passed and we had the sexual liberation and our society has become less uptight about it, nowadays, like you would say, Freudian sleeps could be of another nature, but they usually involve stuff that you're not aware of because you might find it embarrassing or stuff that you have repressed in your unconscious, right? So you have hidden in your unconscious, like a sexual attraction, right? And you say something that you think is just a slip of the tongue, like, oh, I didn't mean to use that word, but it reveals something. I remember there was a great slip of the tongue once, it's a while back, when President Bush, George W. Bush was president. You remember Condoleezza Rice? He's You know who she was? Like his national security advisor. Right? Very smart woman. She used to be the president of Stanford University, right? First black woman ever to be president of Stanford University. Eventually had a distinguished career, unmarried, no significant others that we knew of, right? And once she was giving a press conference, and she was talking about President Bush, and she referred to him as my husband. Right? And then no, I mean the president. So that's a nice slip of the tongue, right? You know, what does it mean? You know, so I'm not saying they had an affair or anything like that, but maybe, you know, maybe in her mind she was spending a lot of time with him as a, you know, as a working partner, and she didn't have a romantic partner in her life. You know, slip of the tongue. You know, what's happening in the unconscious. You know, desire for a particular kind of relationship that she didn't have. But you know, slip of the tongue can be not. They don't have to be verbal. That's why when you talk about Freudian sleeps, is when you take an action that you reveal something. You know, I might be attracted to somebody to stay in the realm of attraction. Right? Let's say I'm attracted to you, and I'm like, I don't want to be aware of it, and all of a sudden I see you in the elevator, and I run to just get in the elevator just as the door is closing, so we can find ourselves in the elevator and I'm not thinking of anything of it, but that could be a Freudian sleep. My unconscious directed me to put myself in a situation an intimate situation, right? So I hope I'm not making you uncomfortable. But you know, that could be considered a Freudian sleep, right? So whenever you have a reaction, something that you do that surprises you, that it's not like you, like I did something that is not like me, you can talk about it in psychoanalysis of like, I did this and I don't know why I did it, you know. It was weird, it was not like me. Or somebody commented on how weird it was for me to do that, or to say that. And I'd like to examine that. So that's what you do in the TalkingCure.